Hello, my name is Miriam Johnson and I'm Professor of Palliative Medicine at the University of Hull in UK, where I direct the Wolfson Palliative Care Research Centre, and I'm also Adjunct Professor here at University of Technology, Sydney. Breathlessness is a common symptom caused by many common conditions, and it can persist despite the best medical treatment of the underlying condition. The trouble is that patients become more and more restricted as they avoid the physical and the emotional activity which triggers the breathlessness. And then on top of that, they can become incredibly breathless. It's so frightening that they end up calling out for emergency services. Sadly, such persistent breathlessness is often thought to be completely inevitable by the patients themselves and their families, and even more sadly, thought to be inevitable and something that nothing can be done about by the healthcare professionals themselves, who they can feel helpless and hopeless. And so therefore what tends to happen is the healthcare professionals don't ask the patient and the patient doesn't ask the healthcare professional. The good news is that as a result of a series of clinical trials, we know that there are interventions, treatments directed at the breathlessness itself that can really help patients and their families cope with their breathlessness and live better for as long as they can, despite the underlying condition being ongoing. Examples of these clinical trials include interventions like non-pharmacological interventions such as breathing techniques, anxiety relaxation techniques, pacing, prioritizing, use of the handheld fan, and also implementation of all these techniques moved in together as a complex intervention delivered by breathlessness intervention services. There are also clinical trials of medications such as low-dose opioids, and ongoing trials at the moment such as mirtazapine trial, looking to see whether this can modulate and reduce that perception of breathlessness for patients. It's vitally important to conduct this research so that we can find out more and more about how to help. We want doctors, nurses, physiotherapists, other allied health clinicians to be able to help patients to live with their symptom, to manage, to get the problem out in the open, to get back to living again, interacting with their families. We have plenty of work to do, and we cannot do it without the patients who act as our trial participants and the clinicians on the ground who are managing and treating these patients, and learn to invite patients to participate in the clinical trials, offering them that opportunity to be part of this incredibly important work going forwards.